Welcome to Scrub In, a podcast where purpose meets care. We are more than just a podcast. We are real stories of hope, expert health advice, and inspiring conversations with the people behind the scrubs.
This podcast will leave you informed, inspired, and reminded of the purpose that connects us all. It's the voice of humanity in healthcare, uplifting, honest, and full of heart.
Featuring hosts Dr. Kendall Barton, Keisha Morris, and Alice Rausch. You can listen and subscribe on Apple Podcasts, Spotify, Google Play, and YouTube. Or visit bayhealth.org/scrubin to learn more. Now, let's scrub in. Here's our next episode.
Welcome to Scrub In, a podcast where purpose meets care. It's Alice, Keisha, and Kendall. And if it's your first time listening, welcome. Make sure you subscribe and leave us a review.
And if you're a regular Scrub In listener, we are so glad to have you back. Let's jump into our quote for today. Prioritizing women's health isn't just good medicine. It's essential to the well-being of every generation.
Awesome. Thanks for that, Keisha.
Yeah.
And today we're talking about navigating women's health, a conversation with an OBGYN. And we are fortunate enough to have one of our very own Bay Health OBGYNs, Dr. Melissa Edler, here with us. So thanks for being here as our first guest of the season.
Well, thank you all for having me.
Absolutely. We'll jump right in. So we're excited to have you. Tell us a little bit about yourself.
Okay, well, I have currently been with Bay Health since 2018, which is so weird. 7 years has flown by pretty quickly.
That's awesome.
I'm originally from Dallas, Texas, which I know sounds pretty random to be in Delaware, but my husband was born and raised in Delaware, and he was a good sport following me around for training, and so we decided to move back where he could be close to family.
That's great.
So, and then we loved it so much that we've been around here ever since.
So when you're not doing your work, what are you passionate about doing in your spare time?
My husband is heavily involved in the town council. We live in Milton, and so that takes a lot of time, and he has been so passionate about being supportive in my career that the least I can do is be supportive in what he is passionate about. So being involved in the town and with politics and the local communities takes a lot of his time, and so I tried to be supportive for him in that as well.
Very cool.
That sounds great.
Yeah.
That's awesome.
So, and also it kind of gives me a step back of, I feel like doing something outside of medicine kind of gives me not necessarily a break, but realizes that this is why I do what I do.
They kind of go together.
Oh, definitely.
The growth in the community and the growth in healthcare.
Right.
So to start out, tell us a little bit more about your why and what gets you out of bed every day.
So I feel like I am honored that my job is to take care of women from basically their whole lifespan, from a young woman, whether she's a pre-adolescent, whether she's got questions about her growing body, if she's unfortunately having some issues with puberty or her menstrual cycles, when she's getting older and she needs to start to have her preventative care, if she needs to have questions about contraceptive, birth control, things like that. If she decides she wants to have a family, I'm there for her every step of the way of that. If unfortunately she's having some struggles with starting a family, or if she decides she doesn't want to start a family, making sure I'm helping her through all of that. And then if for some reason she's got an issue gynecologically, if it requires surgery, I can help her with that. And then in the menopausal transition, I can help her get through that. There are lots of questions that she may have with that. I can help her with that. And then whatever can be on throughout that. So that's pretty cool.
That is very cool. So it sounds like you have a long, extensive period in relationship with your patients throughout the various phases of their overall development. I'm sure you've had plenty of amazing patients with amazing stories.
Oh, yeah.
Would you mind sharing with us one that really changed, either had a significant impact on you or really kind of helped you pivot in the way that you give care?
I just think in general, I think it's just, I just feel honored that since I've been in the community for several years at this point, I've been able to deliver some women's, like several of their children. Mm-hmm. And I just think it's an honor that they continue to come back to me. They're like, okay, you helped me bring one of my children into the world. I want you to continue to bring the other children. And it's cool to even see them get bigger. It's like, oh, now you look like an actual human. So that's pretty neat.
That's great.
And then also I feel honored, like when they bring their mother into my office and they're like, well, would you take care of my mother too? Like that means a lot to me.
That does. That shows a lot of trust with you as a provider. So that's great to hear. Great to hear.
That's great. I want to take a step back and clarify or get a little bit more information from you though. So
Sure.
Tell us a little bit more about what turned Melissa into Dr. Edler.
Okay. So, I grew up in a medical family. My mother was a physical therapist and my father was a veterinarian. And so through my mother's, work, I got into candy striping. And so, I got exposed into the medical field quite young. And then my dad was a veterinarian, so I got to go into his clinic a lot. We were talking before the podcast. May have got to spy on a few surgeries, and I may have gotten in trouble for being a little too close a couple times. So I was always interested from a young age. And then I went into college. At first, I was pre-med in college, but then I kind of took a sidestep for a little bit. And I actually taught high school for a couple years before going to medical school. And then even though, don't get me wrong, I have the utmost respect for teachers, that was just not for me. Mm-hmm. Even though I found that some of my experiences as a teacher, there's a lot of teaching that goes into medicine, as you can tell me that. Or you can agree with that. Mm-hmm. And then I decided then to go back and apply to medical school, and here we are.
That's awesome.
And actually, OBGYN was my last rotation of third year. And I still remember the night that I realized OBGYN was going to be what I was going to go into. It was a crazy night in labor and delivery, running around into all sorts of different issues. And I was like, this is what I want to do. Like, I like the idea of going into a room, not knowing what you're going to get into, but at the end of the day, you're helping people out.
That's awesome. I think a lot of physicians have that aha moment of, this is what I was here. This is what I put on earth for.
Right.
So that's awesome. Thanks for sharing that.
Yeah.
I appreciate that. Kind of going back to education, you had mentioned you were in teaching, and something that I'm very passionate about in my field of medicine is the teaching aspect of it.
Yeah.
Going to work, learning something new every day, whether it's from a patient or from a study. As far as in the field of OBGYN, are there any new innovations, screenings, labs, or anything like that you're excited about?
So just in general, there's been a lot of new I think that they've done a lot more research lately just in what women are experiencing through perimenopause and menopause. And it's one of those, I kind of feel like for a while, and I hate to say this, but let's call it what it is. Women weren't listened to as well. Mm-hmm. And I mean, I know we still have a long ways to go, but I feel like in general, people are starting to take notice. Mm-hmm. And so it's starting to come out. We're learning more things about what women are experiencing, and we're finding new treatments. Mm-hmm. And it may not always be that someone needs medication for treatment of menopause or perimenopause, but at least having the conversation with your healthcare clinician to see, number one, is it related to perimenopause or menopause? It could actually be a different condition. And if that's the case, maybe then that person could direct you to the right person to get the treatment you need. Or if it is related to the perimenopause or menopause stage of your life, what needs to happen next? And then another actually more recent development, and I've seen this a lot because like a human, I'm also on social media. And still, I feel like we still have a long way to go on this, but, pain control during GYN procedures, because I think a lot of us women know that going to the gynecology office is something a lot of us cringe about. And that there are things that, even though, yes, we're not there yet in terms of pain control, but at least it's okay to say something hurts. And maybe your doctor can talk to you about other options, whether it be certain local anesthetic that can be given, or sometimes is it something that normally, I've personally, in my clinical experience, I've taken someone to the operating room for certain things that I may sometimes do in the office, but if I have someone that she's so anxious or so worried, it's better for her to have it done where she's more comfortable.
Absolutely.
Yeah.
Better than her not getting the care she deserves.
Yeah.
It's so interesting as you've talked sort of about that continuum of care from even adolescence through adulthood and beyond. It reminds me of even the similarities of primary care, which you can relate to, and how you sometimes are complementing that as a
Oh, definitely.
in your practice.
Well, and sometimes in a way we are, even though of course I don't pretend to know all the ins and outs of primary care for you, but we sometimes end up being a little bit of primary care for a lot of women patients because they may not, because a lot of young patients don't see a primary care doctor.
And especially in an underserved area.
Right.
We see that a lot of women who come in who have not had a primary care doctor in 10 years, but they've had 6 pregnancies.
Right.
And they've, oh, my OBGYN is my PCP. So, I mean, there's a lot of
Well, and
overlap
pregnancy
with
is
that.
where we kind of catch a lot of, I mean, that's where we catch a lot of diabetes. We catch a lot of hypertension that may have been missed otherwise.
Absolutely. I think it's a great team dynamic.
So how do you then care for a patient that they come in for one thing and then all of a sudden in the middle of their visit, they realize they have these other conditions that they weren't really aware of? How do you care for your patient emotionally and physically in those instances?
So it's more depending on what the situation is. If it's something that, if I feel like I'm appropriately trained to take care of it, of course, I'm going to take care of it. Now, if it means the visit runs a little longer, then of course the visit runs a little longer. If it means I need to bring them back for a follow-up, then so be it. If it's something that I'm not appropriately trained, that's where I'm referring out. If it's to someone that, because again, I know it's been probably addressed on other episodes, but I know that we do have a healthcare shortage in this area. But even if it's to a specialty that is classically known to not have enough providers, we all sometimes will go behind the scenes and be like, hey, I know you're not accepting someone new, but I really have this person that I'm really concerned about. Can you please somehow squeeze them in? And usually we try to do each other a favor. Because at the end of the day, it's about taking care of people.
Absolutely. That's great.
Well, as we talk a little bit more about the childbirth age,
Yes.
we find that we have tons of people who are so curious about the whole process. You know, what's going to happen when I have a baby? What's it going to be like when I get to the hospital? What's it like before I get to the hospital? What kind of advice would you give for an expecting parent?
So one thing is just realize that be prepared to be unprepared. Just even though a lot of people come to us with birth plans, and it's perfectly fine to have a birth plan. We actually, there are certain things you would like during your labor and delivery course, you are welcome. We actually prefer you discuss that with us during your visits. That way we can go over those with you, because to be honest, not everything that someone wants may not be available at every hospital. So it's good that we know that ahead of time. And also something that you may have seen that you want may not actually be safe. And so it's good to know that now. And also that way we can be upfront with you. I always tell my patients that birth plans are in pencil, not pen. Because I can never guarantee a certain situation until after it happens. But at the end of the day, our goal is to make sure mom is safe and baby is safe.
And there are some differences even between our two hospitals. If
Oh, definitely.
Maybe at the Sussex campus versus the Kent campus.
And one thing, and to your point on that, I'm glad you brought that up. Both hospitals offer birthing classes as well as lactation classes, and they're free. And the schedules are available online. And so I always, especially our first-time parents, I always encourage them to look those up. And also, now since I only work at Sussex, I assume Kent does as well, but they also offer birthing tours. So that way you can actually see what a labor and delivery room looks like. Because I know for some people, especially like our type A patients, they like to see everything before they get into the situation.
And they're beautiful rooms.
They are.
At both campuses. The Sussex one, you stay in the same room versus
Correct.
at Kent where you'll deliver and then change rooms.
Correct.
It's great that we have those services to be able to, help a expecting mother or family be able to see all the things before they actually get there. I'm sure that helps to relieve some anxiety that may happen. Yeah, that's awesome.
And when you say safest plan, you slightly touched on people may see something and then think that they want to do that. Where do you think they see things online?
Oh, of course. So, I mean, online, I mean, online has been present for decades at this
Right.
point. So, I'm not saying online is bad in all situations. You just, I mean, and this goes across with whether it's medicine or any subject of information. You just have to check your source. And it's one of those, I mean, I always encourage people to do their own research, but you have to consider the validity of your research. I mean, in medical school, I mean, there's so much information out there. They were teaching us in medical school. You're not going to learn everything in medical school, but you have to learn how to validate your resource. So the same thing with online.
Absolutely. So, switching over to the field of or focusing on mental health now in regards to women's health. I think one of the biggest cultural changes we've seen in medicine over the last decade or so has been with mental health.
Oh, definitely.
It's much more accessible. It's much more, the stigma behind it, I don't think is there as much. So in regards to our mental health, as it continues to become a focus of our everyday life, how do you address issues with like postpartum depression in your patients, and what resources are available for that?
So actually, before every mom leaves the hospital, we actually use a screening tool, to assess for postpartum depression even before they leave the hospital. And if they screen above a certain score, either sometimes that triggers a consult with a mental health professional, or whether before they leave, or it means that they need to get close follow-up. If someone has a uncomplicated vaginal delivery, for example, routine follow-up is 6 weeks after delivery. But if certain complications happen, they're followed up much sooner. An example of that, if they screen above a certain score on their Edinburgh Depression Scale, which is the scale we use, then they are seen within a week in our office.
Awesome.
And if we do see them in the office, then we kind of assess the situation. Some women do really well with medication after delivery. And one thing I'm glad you touched on that. There are many antidepressants that are safe with breastfeeding. So I know that's a common concern a lot of women have, is they're worried that if they start something, they may have to give up breastfeeding. That's not the case. Or they have to make that tough call. Do I have to stop breastfeeding? Which of course that then can make their depression worse. So that is not something that we definitely keep in mind. Or some people may prefer to go through counseling, or counseling may serve them better. And luckily we have a lot of good counseling sources in this area. And I've even sometimes we've called some of them on the phone to be like, hey, can you see this person this week? And so I feel like we've been very lucky in that.
That's awesome. And for our listeners that may not have an OBGYN and may not have access to healthcare, and who are hearing this now and thinking, that might be me, what advice would you give to them?
So that's a good question to ask, because as much like unfortunately, this is a theme that we don't have enough providers for the community that we serve. As much as I want to help everyone, I'm only one person, and there's 24 hours in a day. But anyone that feels like they are suffering from postpartum depression or anxiety, and also people may not know this can occur anytime within 12 months after having a baby. And unfortunately, some people only are on insurance until 6 weeks after having a baby. So then they lose access to their caring provider. So in that case, then I would recommend that they go online. If they type in like postpartum depression, postpartum anxiety, there are so many resources out there, and some of them either are at no cost or on a sliding scale depending on income.
It's always really good to have those resources available, especially if you're not exactly sure where to go. And so being able to have that is invaluable. Well, we've talked about a lot today related to mental health and preventative care, and OBGYN and all those pieces. I'm just curious from you, like, what really sparked your interest around the work that you do, and what drives your passion behind it?
I just feel like it's really great that I'm one of those people, I personally, as a physician, could not take care of one type of condition, one type of thing all the time. So I love the fact that I basically walk into a room and I don't know what I'm going to deal with. So it's kind of like a surprise.
Got it. That's great.
Yeah.
You like that element of surprise. You just walk in and see how I can fix the problem type
Exactly.
of thing. I love that.
And also, I mean, you get this in primary care. It may say they're in for one thing, but then it's totally different.
One problem turns into 20 problems.
Yes. And it doesn't matter how great your MA is.
No. No, the patient.
Well, and also, and too, especially in my field, when patients may feel uncomfortable talking just to me about something, they may not want to, when they call on the phone, number one, it probably took them a lot of courage to even call.
Mm-hmm.
And then when they get someone on the phone, they may not want to tell the person on the phone when they want to talk to.
Mm-hmm.
They don't want to talk to the MA. And so when I finally get in, then they're finally like, okay, I've got the courage, and then I'm going to tell you everything. So I'm like, all right. And then you just got to start going.
So as you said before, you're only one person providing this excellent care to a particular community. I know everyone's always looking for a great provider to be able to service them in whatever specialties. What tips can you give to our audience just to really be able to identify the best provider for them to be able to meet their needs?
So it's one of those that with any provider, whether it be a physician, a nurse practitioner, midwife, physician assistant, you just have to feel like you connect with them and feel like you're being listened to. So when you go in for that appointment, you just need to feel like you can ask the questions that you need to ask, and don't be afraid to ask questions. If when you go in for your appointment, even if it's for your routine annual checkup, if you're having a problem, don't be afraid to say something's wrong.
Mm-hmm.
Or if they give you a treatment plan, or if they're starting you on a medicine and there's something you don't understand, ask. Because I've had patients before where they were like shy about asking something, and when they come for follow-up, they didn't start something because they didn't understand why they needed to do it. Or that you may not be as motivated to do something if you don't know why you're doing it.
Oh, definitely.
And it's one of those, again, I know that there aren't enough clinicians in this area, but if you're seen by someone, and it may not necessarily be that either person is a bad person, but it's just like, for example, two people may be best friends, but someone may not like one person for another reason. You just may not have great chemistry with one clinician or another. So if you see someone and for some reason you just don't click, don't feel like you have to continue to go.
It seems like advocacy is a really big part of your overall care for your patient. Is there like one or two questions you can really suggest that patients would kind of use in order to really advocate for themselves to get that ball rolling?
I mean, I don't know if any question in particular, just, if, they're being prescribed a medication and they don't know what it's for, just say, hey, what's this medication? What's it for? Or don't be afraid of, if they're given a medication and they don't know what it's for, say, are there any side effects to this? Mm-hmm. Or if surgery is being recommended, what's the purpose of this surgery? How is this surgery done? Are there restrictions after this surgery? That sort of thing.
Great question.
Just basics.
Yeah.
Great advice.
I think something that patients struggle with is the idea of like, oh, I don't want to seem unintelligent asking a
Right.
question I don't know the answer to. And sometimes as physicians, we don't do a great of a job explaining it
Right.
to you, understanding that we spent a decade, with our education, learning what these words means or these procedures or the medications. And so if, your doctor or your provider says something that you don't know, ask. We're
Right.
happy to educate. Most of us enjoy education. We've both
Oh, yeah.
mentioned it. And so if you're a patient out there and wanting to advocate for yourself, ask questions.
Right. I mean, the only reason I know all this is because, like you said, we went to school for many years. We talk about this every day. When I go get my car serviced, I know nothing. So that mechanic, I am at his will.
Mm-hmm.
So it's just because this is what I went to school for. That's why I know it. So.
One of the things we talked about a little that you're both passionate about is preventive care. And speaking of questions people may be embarrassed to ask about, what would you tell a female that they need to do for preventive care?
So, go to your OBGYN every year. It's one of those that I'm not sure if all women are familiar with this, but it used to be that pap smears, for example, were every single year. over the last 10 years or so, we have not, for multiple different reasons, we don't have to do pap smears every year depending on the situation. That being said, some people then thought that meant they don't have to go every year. One of my former partners used to use the quote, "You are more than your pap smear," which I think is appropriate.
Yes.
Because still going every year, we're still talking, checking in to make sure you haven't had any issues that have come up with, for example, pelvic pain. You haven't had any changes in your period that could be a sign of an underlying medical issue. Are there changes in your breast that may warrant something else? Making sure you're getting your routine mammograms beginning at age 40. Just because even though you may not notice something just by practicing self-breast awareness, there could be something that's underlying that a mammogram can find before we can detect it even as a physician.
So is there anything you really want the community to know?
So going back to what we were just touching on with the preventative care, just how important it is to get your routine screenings. Well, as obviously for the general population, but I'll be biased from the OBGYN perspective. Make sure you see your OBGYN every year. That way, if you're due for stay on top of your pap smears, because unfortunately diseases like cervical cancer, they don't show symptoms until they're advanced. If you need to have STD screening, because unfortunately, especially in women, many STDs do not have symptoms, and so you could have had one for a long time and not know it, but it's important to have it so that way if it's there, it can be treated before it causes long-term complications. Making sure you are up to date on your breast cancer screening, like we already touched on. Even though, and sometimes if they don't have a primary care doc, I make sure that I stay on top of this as well. If someone is of the age for colon cancer screening, I can help them get into the right avenue for that. And of course, osteoporosis screening as well.
All great screens that we all need to make sure that we're taken care of. So thank you so much for running down that list. That's important.
Yeah.
Dr. Edler, thank you so much for being here and having this conversation with us and educating the community. Really appreciate you being here for our Scrub In podcast.
Well, thank you. I had a great time.
Thanks for listening to Scrub In, where we bring purpose and care to every conversation.
If you enjoyed today's podcast, don't forget to subscribe, rate, and review on Apple Podcasts, Spotify, and wherever you listen.
Stay connected, stay informed, and stay inspired right here with Scrub In.